Hello everyone, welcome back to Neetu Nursing Insight. In today's video, we are going to learn about normal ECG interpretation. This video will help you understand a simple and systematic approach to looking at a normal ECG. We are not going to make ECG interpretations complicated. Instead of that, we will follow an easy sequence, which includes rate, rhythm, P-wave, PR interval, QRS complex, ST segment, T-wave, and QT interval. By following this sequence every time, you can develop a more organized approach to basic ECG assessment. So let's get started. What is a normal ECG? First, let's understand what we mean by normal ECG. A normal ECG generally shows sinus rhythm, meaning the electrical impulses begin in the sinoatrial node or SA node and travels through the normal conduction system of the heart. As nurses, our responsibility is not just to look at the ECG tracing. We should also assess the patient, check vital signs, consider the patient's symptoms and clinical conditions, compare the ECG with the previous tracing when available, and report significant or concerning changes according to our clinical protocol. Now let's look at the ECG step by step. Heart rate. The first thing we assess in the heart rate. For a resting adult, a heart rate of approximately 60 to 100 beats per minute is generally considered within the normal range. A heart rate below 60 beats per minute is called bradycardia, while a heart rate above 100 beats per minute is called tachycardia. However, remember the patient's clinical condition is very important. Heart rate can change due to exercise, pain, anxiety, fever, medications, dehydration, and many other conditions. So, always interpret the heart rate together with the patient's overall condition. Rhythm. Next, assess the rhythm. In normal sinus rhythm, the rhythm is generally regular, meaning the RR interval are relatively consistent. We also look for a consistent relationship between the P waves and QRS complexes. A normal sinus rhythm generally has a P wave before each QRS complex with a consistent pattern. P wave. Now let's look at the P wave. The P wave represents atrial depolarization. In normal sinus rhythm, there should generally be a P wave before each QRS complex, and P waves should have a consistent appearance. This indicates that the electrical impulses is organized from the sinus node and traveling through the atria. When assessing the P wave, look at its presence, shape, relationship to the QRS complex. When assessing the P wave, look at its presence, shape, and relationship to the QRS complex. PR interval. Next is the PR interval. The PR interval represents the time taken for the electrical impulses to travel from the atria through the AV node and conduction system toward the ventricles. The commonly accepted normal PR interval is approximately 0.12 to 0.20 seconds. When assessing the ECG, look for a consistent PR interval. A prolonged or unusually short PR intervals may indicate an abnormality and should be assessed in the context of the patient's clinical condition. QRS complex. Now we come to the QRS complex. The QRS complex represents ventricular depolarization. A normal QRS complex is generally less than 0.12 seconds in duration. When assessing the QRS complex, look at its width, its morphology, its consistency, and its appearance across the different ECG leads. A wide or unusual QRS complex may indicate an abnormality in the ventricular conduction and requires further assessment. ST segment. Next, assess the ST segment. The ST segment is normally close to the baseline or isoelectric. As nurses, we should pay particular attention to new or significant ST segment elevation or depression, especially when the patient has symptoms such as chest pain, shortness of breath, sweating, dizziness, or hemodynamically instability. Remember, an ECG finding should never be considered in isolation. If concerning ST segment changes are present, assess the patient promptly and report or escalate the findings according to your hospital's or clinical protocol. T wave. After the ST segment, we assess the T wave. The T wave represents ventricular repolarization. We assess the T wave by looking at its shape, direction, size, and relationship to the QRS complex. T wave abnormalities can occur for many different reasons. Therefore, abnormal T wave should always be interpreted together with the patient's symptoms, clinical condition, and other ECG findings. QT interval. Finally, we assess the QT interval. The QT interval represents the total time for ventricular depolarization and repolarization. Because the QT interval varies with heart rate, clinicians commonly use the corrected QT interval or QTC when assessing whether the QT interval is prolonged. QT or QTC interpretations can be clinically important because significant QT prolongation can increase the risk of certain ventricular arrhythmias. Easy ECG memory sequence. Now let's make this very simple. When you look at an ECG, remember rate, rhythm, P, PR, QRS, ST, T, QT. So, first check the rate, second check the rhythm, third look at the P waves, fourth assess the PR interval, fifth look at the QRS complex, sixth check the ST segment, seventh assess the T waves, and finally consider the QT interval. This simple sequence can help you approach an ECG in the consistent and organized way. Important message for nurses. There is one very important point I want every nurse to remember. Never interpret an ECG separately from the patient. Always consider the patient's symptoms, vital signs, clinical condition, previous ECGs when available, and any new changes compared with the patient's baseline. If you see a new or concerning ECG change, especially in the patient who is symptomatic or unstable, do not ignore it. Assess the patient promptly and escalate according to your hospital policy and clinical protocol. ECG interpretation is a skill that becomes easier with regular practice. The more ECGs you look at using a systematic approach, the more confident you will become. So this brings us to end of today's lesson on normal ECG interpretation for nurses. Today we learn a simple and systematic approach to ECG assessment: rate, rhythm, P wave, PR interval, QRS complex, ST segment, T wave, and QT interval. I hope this explanation has made basic ECG assessment easier, clearer, and more understandable for you. Thank you so much for watching Neetu Nursing Insight. I truly hope this class was helpful and useful for your nursing practice and clinical learning. If you found this video helpful, please like, subscribe, and share it with your friends. Your support encourages me to continue to create more simple and practical nursing educational videos. Remember, keep learning, keep caring, and keep inspiring. Thank you for being part of this learning journey. I will see you in the next nursing class with another important and useful topic. Take care, stay safe, keep growing, and keep making a difference in nursing. Thank you so much for watching Neetu Nursing Insight. See you in the next class.